Dr. Ken, I'm so happy I found you. I actually urgently need to see you. When I see the word urgently, trust me, the hair on my back stood up a little bit. I said, what is so urgent? She said, well, it's so hard for me to describe to you on the email. I'm going to have my husband take a picture and send you. Now, how many of you have ever had that experience that you're waiting for that really urgent email? That sensation. Guess what? You check the inbox of your phone 60 times per minute. I remember distinctly, my friends, the first night, that email did not show up. I did not sleep very well. The next morning, I saw that email. I scrolled down, I saw an attachment, and I clicked on it. I want you to think carefully here. When I saw this, all right, am I proud to see that? No. The first thing I said, did I really do this? The second question I asked myself, what type of toothbrush is this patient using? All right? And then, the third thing I told myself, you know what? This picture should never see the daylight. Like a vampire, you should never see the daylight because this could tarnish my name. Joseph Ken is going to be tarnished. All right? But worse yet is she dropped me an email back. She said, Dr. Ken, I'm coming back to Los Angeles to see you. Now, I'm sure many of you have treated patients. Some of you, after you treat some of your patients, you actually never want to see that patient come back again. Sad thing is, that patient returned. Like that movie Star Wars, okay? Return of that patient, all right? When the patient come back to Los Angeles, I took some x-rays. You look at on the right side of the periapical radiogram, what do you see? The bone is perfect. You look at the clinical picture, you often wonder, why does modern day digital camera need to have such high resolutions, right? Then you look at the CBC scan on the right that's taken 16 years after surgery. There's no buccal bone. Maybe Professor Yan Lin is correct, or that two classical article that published in Journal of Clinical Periodontology. Remember that bundle bone? It's gone. It's gone. Now what? If this is your patient now, what will you do? How many of you have treated patient end up having a gingival recession around the implant? And then what do you do? I don't know about you. For me, you know what? Every time when I see a problem, you know what's the first thing I do? Right away. I just basically kneel down on my knees and say, please help me. Please help me. I pray a lot in my practice sometimes, okay? It's not easy with clinicians, all right? Now, then what? Before we go back to this patient, let's look at patient number 2. Patient number 2 is even more interesting. One of the most interesting patients I've ever come across in my life, to be honest. Why? Because her mother is a very famous Hollywood movie star. She's on the movies all the time. And then the mother brought the daughter to me and said, Dr. Ken, I heard you are one of the best, so I want an implant for my daughter. You should be able to take care of it. I said, no problem, just stand down. So I take her to surgery. I said, all right, this is the day of the surgery. I'm going to open the flap, put a small diameter implant in there, and in those days, I put a provisional, did a little tissue graft in there, and put a provisional and suture. All right? And subsequently, I finished the case. Mothers love it. Daughter loved the results. I get invited to movies openings, red carpet, Joe Ken on the red carpet, okay? Rubbing shoulders with the Hollywood movie stars. Heart-taking time, all right? Every few years she came back, everything looks good, okay? Everything looks good, and everybody's happy. Okay, until one morning, I remember, I always check my schedule, clinical schedule that is. I look at the schedule, I saw this patient's name. I said, wait, is it time to recall yet? Maybe it's not. So I called my front desk, I said, hey, listen, I woke up. How come patient so-and-so is on the schedule? Is time to recall yet? No, it's not time to recall. And besides, but my staff said, besides, her mother want to talk to you. I said, what do you mean? I said, is that a movie opening you want me to attend? Right? And then I called the mother. The first thing the mother asked me is this, Dr. Ken, I want you to take a look at my daughter. I say, is there something wrong? He said, well, you tell me. I said, great. So what do? I start kneeling down on the floor again. I say, This deserves a prayer time, okay? Another prayer time. So the thing is this, I go in there, I take a look at her, and she looks like this. What do you think? 2 patients, ladies and gentlemen, that Joe Ken treated. One with a big recession, one soft tissue actually came back significantly. Let's take a closer look. What can we see here? All right? This day of the surgery, I asked myself, did I do something wrong? I treated this patient a long time ago, okay? Maybe close to, 18, 19 years now, okay? And because of the size of the missing space is so small, I need to find a small diameter implant. Back then, there ain't a whole lot of small diameter implant except this one here, which I don't really prefer. I need to prep it because I need to make a provisional onto it. I need to use a pickup impression, right, to copy this thing. But by looking at that, ladies and gentlemen, what do you think about the implant position? Acceptable or not very acceptable? What do you think? How many say acceptable? Come on, acceptable, please. Very acceptable, right? Position is quite good, right? Then what went wrong then? Let's take a look at what I did. I take a piece of sashimi, I grab it. Okay, sashimi is one of my favorite food group. Okay, I put that sashimi in there and suture around the provisionals. And everything looks good. Why did this happen? I want you to take a closer look over the next 12 years. What happened? When you look at the facial position of the crown, you know that it's slowly creeping coronally. However, I also want you to look at the incisal edge of this tooth. What do you see? It's actually intruding. Wait. How can an implant move? Can an implant even move? No, because there should be no PTL, right? Why is the implant moving? Why is the implant moving? What do you think? Let's look at a patient from the incisal edge position. All right, 2003. Now, if you look at the facial aspect of the crown, of course, it's not even intruding. It's also palatally version. It starts moving palatally, all right? And not only that, if you look at the lingual aspect of the crown, underneath there, you see that rugae right there? You see that rugae? And if you look at it, over time, the distance between the lingual portion of the crown and the rugae starts getting less and less. So implant is moving, something's moving. Why is it moving? Why do you think it's moving, ladies and gentlemen? Why can an implant you place be moving? Can someone tell me? I heard Penang is a party town. How can it be so quiet? Why do you think this happened? Well, let's look at the patients a little bit more facially. This is what you see. Things are intruding, soft tissues are growing. Why do you think that's the case? Can someone tell me? Growth? What do you mean growth? Or maybe what you refer to is, what is the youngest age that you are willing to place an implant on a patient? A young patient. Well, let me throw that question back at you. If this is your patient, what's the youngest age you're willing to put an implant on a patient? 18 years old. 19? 20? 21? 22? Do you guys place implants here? 23? 24? Well, what age did I place my implant on this patient? She was 22 years old and 10 months. Is that too young to put an implant on the patient? What do you think? Or this is okay? When does the age growth stop? All right, but let's take the thinking process one step further. I think this set of radiographs taught me the biggest lesson. Why? Because if you look at implants are in a constant position, but I want to look at the patient's right central incisor sitting on the right side of the implant. You see that right side of the implant? I want to look at the apex of that central incisor sitting on the right side of that implant. You see the apex right there? What do you see? If you look at the apex, you see, ooh, it's moving over time. It's moving over time. All right? So either the teeth are moving or the implant's moving. Understand? All right. But then, not only that, I want you to look at something. What did I learn here? The patient came to me when she was 22 years old. And between 2003 to 2004, if you look at the apex of the root tip, nothing happened. However, now patients around between 23 to 25 years old, very mature, the growth should stop like that, but yet something moved. you look at when between 25 and 26 years old, nothing happened. But now, if you look carefully between 26 and what? 34 years old. Patients 27, 28, 29 years old, okay? Yeah, something moves again. Why? Let me tell you. I love basketball. I'm like a big fan of basketball, like Michael Jordan or the big basketball fan, okay? Unfortunately, I'm 5'11". 5'11". I want to be 6'5". Does that mean at this point in my life I can still have that possibility of growing to 6'5"? What do you think? Okay, so basically I told the patient, all right, this is a treatment. The funny thing is that she never noticed the implant crown intruded. All she knows is my gums, my tooth is looking short, and my gums, is really not in the right position. I don't like it. So I told her, no problems. Let's call my front desk, set up an appointment. In 2 weeks, you're going to come back to my office. I'm going to do a very simple periodontal surgery for you. Got it? Called gingivectomy. I'm going to remove some tissue to make the tooth look good again. And she said, okay, and done deal. All right. I remember last year I was speaking in Singapore for 3 days. Why did I think about that? Because suddenly I remember a lot of things happened within that Singapore trip, and now, why? Because guess what? 2 weeks after this appointment, on the day of the surgery, I'm all scrubbed up waiting for her. She did not show up. She did not show up. I did not tell you that back then. She did not show up. So I told my front desk, did you confirm patient? Oh, we called, but no answer. Call her again. Call her many times. No answer. Oh, let me call her mom. She did not answer my call either. I say, shoot. There goes my Hollywood connection. Is my mom coming back? After many appointments, I keep telling front desk, call her. Okay? After around 6 months and many calls, my nurse get tired of me. She said, Dr. Ken, she's not coming back. Be real. Face the reality. They're upset at you. It's great. I gave up. Never seen the patient again. But funny thing, after I lectured in Singapore, I went back to my clinic. One day, I looked at my schedule, and long and behold, I saw this patient's name on my schedule. So that Singapore trip did something to it, maybe. And I asked my friend, I said, wait, is this a mistake? You sure it's this patient? She said, yeah, this is an appointment. I set it up. I said, wait. You call the patient or patient call you? Oh, patient call you. Call in for an appointment. She wants to see you. I said, really? I haven't seen the patient since 2014. It's more than 10 years. I haven't seen her. What is she coming back here for? So I said, well, great. At least she come back. And when she came to my office, the first thing she did is she lifted her lips up and said, Dr. Ken, I am scared. I am scared. I look at her, I say, all right, what's going on? Oh, I feel that I have some growing in my jaw. Great. Okay, she's now in her 40s, beautiful looking lady. And I said, what happened? How come you didn't come back? She said, well, why did I ask that stupid question? She literally told me that we were really upset at you back then. Okay, great. Confirm my feelings, okay? And then she said, what did you do? Oh, because we were so upset at you, we decided not to come back to you. So we went to Beverly Hills to look for a periodontist, and this periodontist did a soft tissue procedure, and the tooth looks great. I'm happy. But as time goes on, that soft tissues are going back, and now I have this big bump on my jaw, and it's getting bigger and bigger. I feel very, very scared now. I need your help. So I say, all right. What's going on here? The first thing I think about, all right, let's take a CT scan. Okay, maybe we have some sort of tumor, right? This is not a good news. I checked, radiographic scan looks okay. All right? And then I go in there and take a look at what happened over 22 years. All right? The gingiva basically, in the position is like that. The tooth rotate a little bit more. But you see, there's even a greater degree of diastema developed between the implant and adjacent teeth now. Something expanding. Not a very present thought at all. So when I look at it, remember I told you about the facial aspect of the tooth is moving more parallelly, but when you look at the lingual aspect of the crown and the rugae, now it's basically gone beyond the rugae. Significant movement here. And then I try to go back on my pictures over the last 22 years. I say, hey, back in 2005, there's already a little lump there. I just didn't notice that. I didn't pay attention. Back in 2007, when I saw her again, there's a lump there, but I just didn't pay attention. A lot of times, even when you treat patients, you wear loops, can you really see? No. Until I really come there and say, whoa, what is going on here? And when I look at the radiograph, all right, 22 years later, when I look at the adjacent teeth, of course there's even more movement. Now she's in her 40s, and there's still movement occurring. Now what? If this is your patient, what would you do? Things get more and more complex. The longer I practice, let me tell you, the more humbling I get. Truly, I really thought that the more I practice, the smarter I should become. But untrue. When I was first graduate, all this flamboyancy about, oh yes, I have all this degree, I have a name, whatever. Now I realize that all this degree, all this specialty is just a name. And I realize that I should never let those degree or name define me at all. So now what? What am I going to do? We're going to talk about it. We're going to talk about patients like this. Very humbling. I just told you two simple cases, ladies and gentlemen. Both of them high smile line. I treated years ago. And let me tell you something too. Time, ladies and gentlemen, is our best teacher. I want you to remember as a dentist, regardless you're a general dentist or specialist, time is going to be your best teacher. Because whatever we do initially is perfect. Even so many research I did that,